Hi there and welcome to this video. Dr. Sandhu here from Bedford Chiropractic Clinic, the most experienced chiropractor in Bedfordshire with over 25 years experience and having treated well over 30,000 patients and completed 130,000 plus adjustments on my wonderful patients. I'm here to explain to you today about foot and ankle pain and how I can potentially help you resolve those issues. Now, you may be experiencing some foot problems, you may be experiencing some ankle problems, you may be even experiencing knee, hip, back problems as well. Well, rest assured that I can help you. Today in particular, I'm going to focus about sort of foot pain because the feet are really, really important because it is conclusively been proven with x-rays that this is a normal foot. So let me show you what is considered a normal foot. You have these three wonderful arches in here and everything is aligned, everything is as it should be, right here. The problem is that majority of patients certainly sort of are like that. So if we have a look here, okay, this is a normal foot. This is what is known as a pronated foot where the arch has gone. Those arches now are not there to support the foot. So what that literally means then is that what happens is the ankle rolls in and the knee has to follow because obviously that's one bone. If the knee then is affected, then that bone there attaches to the hip joint. So now the hip joint is affected, which now means that the pelvic girdle is affected, which means now that the lumbar spine is affected and so on up into the neck. So you can see here how the foot can affect the knee, the hip, the pelvic girdle, can affect then the lumbar spine right up into your neck. And Professor Rothbard did an experiment where he x-rayed the person, and in particular the x-rayed the cervical spine, and he found that when the patient moved their foot, the actual sort of cervical spine moved as well. So the feet are really, really important. And if you are experiencing sort of foot problems, then it is important to get it looked at, and especially if you've sprained an ankle or you are experiencing some ankle problems as well, because the rest of your body will be affected by what's happening down here. The foot is an incredible piece of sort of architecture. You have 26 bones, 33 joints, 107 ligaments, 19 tendons, and 20 muscles in this incredible structure, and you have two of them. The problem that we have as Europeans is that as our children grow up, we stick them into shoes and we basically trap these wonderful, wonderful sort of bones and these joints and these muscles in here, and we don't allow those muscles and joints to work properly because we are supporting them with shoes. And of course, as the child progresses up to the age of 16, when all of these wonderful bones ossify and become sort of a calcified, you then sort of lose that ability to grow and develop. And unfortunately, the muscles and ligaments now are weak. And then of course, you've got the issue of what the force that they are putting onto the ankle and the rest of your body. So if you are experiencing any sort of foot problems, it's really important to get it sorted as soon as possible, because the longer that you put up with a foot or ankle problem, the more of an effect it's going to have all the way up the body, right up into your neck. And it is imperative that you deal with it quickly. So if you are experiencing a foot problem, experiencing a neck problem, or even a knee or hip problem, a back problem, neck problem, shoulder problem, right, rest assured that I'm here, Dr. Sandhu, Bedford Chiropractic Clinic, to help you, because I treat the whole body. Right, so I don't treat bits of you, and I see the body as a unit that works together. So when you come, I will be examining all of you. So you're going to get a complete health check, and we're going to find out the underlying cause of your symptoms. We're going to adjust you, we're going to treat you, I'm going to teach you some exercises, I'm going to teach you rehab, we're going to look at sort of what it is that caused the problem, we're going to look at the ergonomics, we're going to look at how you're sitting, standing, walking, your posture, all of that, and then I'm going to help you to resolve the issue. So if you really want a resolution to the problem and you're sick and tired of taking painkillers, if you are, then please don't carry on. Right, give us a call today. Let's get you sorted. The number is down below, and I'm here to help you. Dr. Sandhu, the most experienced chiropractor in Bedfordshire, and I look forward to helping you. We've got lots of videos on this playlist of other conditions that I can help you with. Do have a look at that as well, and follow us on YouTube, follow us on social media, follow us on all our social channels, because we are here to help you resolve your issues. And I wish you all the best, but ring now today. Let's get everything sorted out, and let's get you better. God bless you.